Hello, welcome to the Women's Empowerment Series. My name is Celeste Rose, owner of the Sensual Leadership Academy, and I'm here today with Sara Abbott from Cultivate Physical Therapy. And our topic of conversation today is overcoming painful sex. So I would love to welcome you, Sara, and tell us just a little bit about your business.
Yeah, so I opened Cultivate Physical Therapy in 2022, and I opened it mainly to focus on pelvic health for all adults and pediatric populations, as well as general pediatrics too. So the reason I decided to open Cultivate Physical Therapy was I really wanted to be able to treat patients in the way that they deserved to have treatment. I wanted them to be listened to have the time to actually spend with their provider and not be passed around between providers, not be quickly passed through so that they can get in as many patients as possible. I really feel like having one-on-one care for a full hour is crucial to helping patients have success and have them stay successful throughout their lifetime, instead of just quickly treating things and getting past the symptoms and then, oh no, it comes back later. We don't want that to happen.
Absolutely.
Yeah.
Yeah. Well, I totally can relate to what you're talking about, going to the doctor and you wait like 45 minutes or whatever in a waiting room, and then you end up seeing the doctor and it's quick, like in and out. And sometimes you don't feel like you got all your questions answered. And maybe there's deeper concerns that feel of a more intimate nature, like painful sex, that you don't have the opportunity to discuss with your provider because there's not enough time to create that comfort level.
Yeah, absolutely.
Yeah.
Yes.
So tell us a little bit about the different types of pain that women or humans might experience in sex.
Yeah. So there's a couple different types of pain that are more typical, I guess, when it comes to painful sex. So there are two big words. One is vulvodynia, one is vaginismus.
Mm.
What vulvodynia is that there's pain around the opening of the vagina, and I've got my pelvic model here. Um, so a lot of people, first of all, it's great to know what is a vulva versus what is the vagina. So that vulva is actually the area all around, like in the front of your pelvic floor. So all the way around in here. We've got all kinds of things that fill that area. The vagina is its own separate location, which is inside of that vulva. So the vulvodynia is where we have more pain around that vaginal opening and more in that vulva area. Vaginismus is where we actually have a spasm of the muscles inside the vagina or surrounding that vagina. And they can occur in different spots. You can have pain more like with external touch. You can have pain more with like the insertion during sex right at the beginning, or deeper pain. It just kind of depends on the purpose and what all is going on.
Okay.
Yeah.
Yeah. And so when women are experiencing painful sex, what are the kind of things that they typically notice, or what comes up for them?
Yeah. So a lot of times patients avoid having sex because they're worried about having that pain again, or they're worried that something major is going on, and that's why they're having pain, which is an understandable thing to be concerned about of, this shouldn't be here. Why is this happening?
Mm.
And so that fear of having sex or just avoiding it completely can happen. Another thing too, people can have pain with like certain sexual positions, and just avoid those altogether because, well, I don't want to worry about having to have pain. Another thing too is some people just deal with the pain and feel like they have to, that they just have to allow their partner to have sex and not be able to enjoy it themselves,
Oh,
which is not fair.
absolutely. And as you say that, like with my business and empowering women and helping them reconnect with their body and having boundaries and really like recognizing the needs of the body and the desires of the body, overriding that can be really detrimental to relationship with ourselves.
Yeah. Yes.
Yeah. Yeah.
Absolutely. Yeah. Go ahead.
Can you tell me like some common misconceptions or myths about painful sex?
Yeah. So, and some of these come from patients that I worked with. Some of these are just like general misconceptions about um, pelvic pain in general and painful sex. One is that a lot of times people are told, it's just in your head. Like everything looks fine. Pain's just in your head. Just get over it. That is not true. And I really tried to validate that when patients come to me and tell them that this is not in your head. Yes, pain has multiple components to it, in which some of them can be emotional and then some of them can be physical, but they all work together. It's not, you're not making this up. And so what I really focus on is doing an exam and making sure we're finding, why is this happening? Where is this pain coming from, so that we can correct it and you can just enjoy life. You can enjoy sex again, because you deserve to be able to do that.
Yeah, I mean, sex is such a fulfilling aspect of being in a human body. And
Yes.
so
Yes.
much pleasure can be experienced, and the benefits of pleasure are, there's so many benefits. The endorphins, the hormones, the chemicals that are released in our brain when we experience pleasure can be deeply healing, and also help with stress and anxiety, and just help us in our overall well-being.
Yeah, absolutely. Absolutely.
Are there any other misconceptions or things that people might think of when they hear about painful sex? Maybe their friend is having painful sex, or maybe they're having painful sex. What are some other misconceptions?
Yeah. So a big one is people are told, well, if you can just deal with it and get pregnant, then once you have a baby, everything will be fine. You won't have painful sex anymore because everything got stretched out. No, that's not true. Yeah, and it frustrates me when people come in and they're like, well, I was told that if I just got pregnant and I had a baby, then everything would be normal, but now it's worse, or now I'm still having these issues and I went through all of that and I don't know what to do. And first of all, no one should have ever told them that, because not backed by research. It's not a true comment. But also you never address the cause, like the root cause of what's going on. You never found out, why are they having painful sex? There's so many reasons you can have painful, or reasons for having painful sex, that why aren't we looking at the reason for that and correcting that to allow them to enjoy sex, enjoy life, all the things. That we got to get to that root cause.
Yeah, absolutely. And it's so interesting, right? Because so much of the research around sexuality is painted through the lens of male sexuality. And I can guarantee you, if men were having painful sex, there would be scientific research around why. Like, we wouldn't just say, oh, well, that's normal, or, oh, do this, and then you won't have it anymore. Like, there is a root cause. And so I'm curious, what are some of the root causes? I know you mentioned some can be physical, some can be psychological. Can you
Yeah.
expand a little bit on what some of those causes of painful sex are?
Yeah. So muscle spasms are a big one. If you have a ton of tension in that pelvic floor, which a lot of us, our daily lives can be stressful, all of that, and we can hold some of that tension, not only in our shoulders, but also in our pelvic floor. And that pelvic floor, if it's constantly tight, it can not only lead to constipation, it can lead to pain, it can lead to pain with sex, it can lead to urinary dysfunction, all of those things. If those muscles aren't functioning properly and they're not able to fully relax and contract in the way that they're supposed to go, relax, contract throughout your day. If they're always in that tight state, it's like if I had really, really tight muscles in my shoulders and they get really, really tense. And if I push on it, it's like, oh, that's a tender spot. We get the same thing in our pelvic floor muscles, because they're muscles too. It can seem weird, like, oh, really? It's like, it can be like any of my other muscles. Yeah, it can. And so, yeah, muscle spasms are a big one.
What are some things that that women can do to address the muscle spasm aspect of painful sex?
Yeah, so there are various things we can do to address that. One thing there's a couple tools that we can use for those tight muscles. One is, it's called a pelvic wand.
Okay.
So this guy, I really like a brand called Intimate Rose. Not sponsored, but I do really like them. But everything's silicone coated, and just it feels a little bit nicer to patients than like a hard plastic can. So what this guy is, we have two separate ends that you can use to address those tight muscles. And it's almost like if people have seen like a Theracane or something similar, it's putting pressure on those tender and trigger points and allowing those muscles to release and relax. So you can use either end, and depending on if you have pain with anything like larger or just have more of a fear, you can always use smaller end too. And then we also have this larger end that then has more of like a point to it there.
Okay.
And what you're doing is really just finding those tender spots and letting them release. And this is a great tool to use at home too. When you come into pelvic floor therapy, as long as the patient is okay with it, we do an internal exam, either vaginally or rectally, just depends on what they need and what they're okay with. And what we're trying to find is, where are those tender spots and what's going on in there? Is it tenderness? Is it just super weak? Are you having trouble relaxing at all? Are there specific areas that are tight? We're just looking at all of that. And this is a great tool for you to take home that your therapist can work with you to figure out how you can continue to work on those things on your own too.
Yeah.
Because we want to empower patients to be able to work on things on their own as well. So another tool to help with pelvic floor tension and those muscle spasms are using dilators. So we got various sizes. We've got our smaller dilators up to our larger dilators. So whatever size we use kind of depends on, one, what you can tolerate. And if the smallest one's what works for you best, then that's what we start with. Our goal is then to kind of work your way up to whatever size you need to, whether that is penetration with a partner, with a toy, with whatever, tampon, whatever your goal is. And we find the size that is your goal to work up to.
Okay.
And what you do with these guys is, using a lot of lubricant, what we do is just slowly insert, and then you work on some good belly breathing, to allow your body to relax into a stretch. So you're allowing that vaginal canal to stretch around the dilator and allow it to accommodate that larger size that may have previously given you pain.
Yeah. And so with the dilator, you're starting at a smaller size and you're working your way up to train the muscles to accommodate a larger.
Yeah. Yep. And to allow those muscles to have more of like a prolonged stretch.
Okay.
Yeah. So just allows you to let those muscles figure out how to accommodate a larger size too. So,
Okay.
yeah.
And I love that you talked about the belly breathing. So one of the tools that I use in my coaching is genital breathing, lower belly and genital breathing. And so we focus on breathing with our awareness into, as if you could breathe in through your vulva.
Yes.
And into the lower belly. And what that does is, like you said, helps you connect it. It almost silences that, it gets you out of your head, and it connects you with your body, and it can really lead to a deeper sense of relaxation and connection with the body that I find really powerful, because then you're able to relax, right?
Yes.
And you
Yes.
might even realize that there's like, whoa, I didn't realize how much tension I was holding in my pelvic floor, but now I'm seeing that through this practice.
Yes. Yes, absolutely. Another thing is a history of trauma. So if people do have a history of trauma, no matter what type of trauma, if it's a big T, little t trauma, doesn't matter. That trauma can really be held in our pelvic floor as well. And depending on what has gone on in your past or your present, that fear of having sex, or fear of pain, fear of that connection with your partner can be very, very difficult, and can lead to that pain with sex as well.
Absolutely. Yeah. I'm so glad that you mentioned that, because even if someone were to come or talk to a provider about painful sex and there's no physical indicators of painful sex, they might think that it's all in their head. But when you have a history of trauma, any sort of, and even I want to point out, like you said, big T or little t, it's not just something that you would even consider trauma. Sometimes, especially like you said, women will have sex with their partners even if they don't want to, or even if their body doesn't want to, because they feel like that's what they're supposed to do. And so sometimes, in my experience and through my training, that trauma can be caused and held in the body from the body's perception of having sex outside of consent.
Yeah, absolutely.
In my practice or in my field, it's called de-armoring, or de-armoring the vaginal canal. And so, because if you think about armor, we put up armor to protect ourselves, right? And so your body puts up armor to protect yourself in your vaginal canal. And so that can be that's what we're working with, is releasing that armor. Now, this goes then to the aspect of pain because of trauma. So if women are working with tension in the pelvic floor, and they touch on a spot that is painful, it could then bring up emotions or memories or connection to past experience that may have been negative for them. Do you discuss that with clients, and how do you approach that subject?
Yeah. So if it is bringing up some of those traumatic experiences or difficult experiences for a patient, a lot of times I encourage them just to take a break for a moment, because there's no need for you to force yourself through going through these memories and this difficultness. And honestly, the likelihood of you being able to fully relax and get the goal of what we're working on probably it's not going to be super helpful. Just go right through it. Another thing I encourage them to, if it is bringing up, and even if the internal exam that we do in therapy is bringing up things for you too, we stop then as well. And I encourage them to work with a mental health therapist as well, because a lot of those things may be unaddressed and can be super helpful to work through outside of physical therapy as well.
Absolutely. Because I do work with more of the energetic and emotional, psychological imprints of that, and through my practice. And it's so important to have that support, because even if it comes up or they feel that connection to past traumatic experiences, they still want to be able to work through it. But it would be important, if you're working with them in conjunction with a therapist or someone trained in helping people release sexual trauma or sexual experiences being held in the pelvic floor. So
absolutely. Yeah.
So tell me a little bit more. So we've covered muscle spasms, we've covered past history of trauma. What are some of the other causes of painful sex?
Yeah, so infection can be another one. So there could be something happening down there with, whether it's like a bacterial infection, yeast infection, all different kinds of things that could be going on that we also want to rule out too. So we always like to go through the whole list and make sure that we truly are ruling everything that could be going on out, because you deserve to figure out what's going on. And so that's one thing that would be more, it's probably sending you back to your physician to make sure they can get those tests in for you too.
Absolutely.
Some other things too can be hormonal imbalances. So if hormones aren't quite right, then we can have a lot of dryness. We can have muscle atrophy too, or muscle tightness too, that can happen just with those hormone fluctuations. Okay. So I also like to talk to people about using lubricant, and that It doesn't mean something's wrong with you if you have to use or want to use additional lubricant. And finding the one that's right for them too, that they feel comfortable using, they like using, they don't have issues using. That's a huge thing, I think, with painful sex, is finding a lubricant that works well for you. So
Absolutely. Because, yeah, there can be this idea of like, well, if I'm turned on, I will get wet, or so
Mhm.
they say. But it is possible that you need assistance in that area. And that doesn't mean
Yeah.
there's anything wrong with you. It
Uh-uh.
just is a way that you can make sex more fun, feel better. And yeah, absolutely. The
Yeah.
other thing that I want to point out as you say that is lubrication. What I find is a lot of women are penetrated far too soon. And if we don't wait and have a little bit of foreplay, and what I find too is a lot of times partners will go straight for the genitals.
Yeah.
Um, and what happens is, like, in the female body, our turn on starts at the periphery. It starts, caressing our neck or other parts of our body that bring arousal and turn on. And when we go straight for the genitals, it's like trying to start a car in the winter cold. It just doesn't work very well, and the car doesn't really enjoy it very much. And so I think adding that element of foreplay and really making sure that you're not being penetrated before you're ready is
Mhm.
really going to help with avoiding that painful sex as well. And then introducing lubricant that works well for you, that your body, that doesn't cause you infections. I know different people
Yeah.
respond to different things differently. Do you have a particular brand of lubricant that you like or that you recommend?
So a couple different ones. Good Clean Love is one I like. Slippery Stuff. Um, I'm blanking on names right now. Coconut is another really good one too.
Okay.
Um, that I've had patients really like as well. Yeah. Do you have any of your favorites that you like?
Um, there's one called Just Like Me,
Oh
from Pure
yeah.
Romance that I like. I think it's a water-based lubricant. Um,
Nice.
but yeah, yeah. I know it's challenging to find one, and there's so many different kinds in the market. I think
Yeah.
one important thing to think about is, if you are prone to infections, not using a lubricant that has like a scent or something like that, because that can cause irritation as well and contribute to yeast infections.
Absolutely.
Yeah.
Yes.
Yeah.
Yeah.
Okay. So you said hormonal imbalances. Anything else? Any other causes of painful sex that you want to cover today?
Yeah. So a couple other things. Some people can honestly just be born with different anatomy.
Mm,
So, or different than would be typical, I guess. So you could have different types of hymen can cause pain depending on what's going on. So it could be that you have a hymen that's still partially intact and that it's causing pain because there's constantly tension being put on that. Um, and just different variations of that. You could have this is not terribly common, but even like a vaginal canal that would have like a separate line of tissue in it that's just causing it just formed differently.
mm,
And so, and there could be various options. And with that too, one being surgery potentially, that if it does cause you a lot of pain, and it's really causing issues for you, then that can be something that a surgeon could look at for you too. Just general inflammation can be another one too, that if your body is very inflamed, you're not getting good blood flow to that tissue all the time either. And then you're kind of getting a buildup of, if you think like if you work out and your muscles get kind of like almost like boggy
mm.
and they're not quite working right, that can happen in your pelvic floor as well. And if you have a bunch of those kind of that crud that your muscles want to get rid of and get out of your body, if it's all stuck in there, that can cause some discomfort there too.
Absolutely.
Yeah.
So it sounds like there's a lot of different causes for painful sex,
Hmm.
but there's also a lot of different solutions,
Yeah.
um,
Yeah.
including pelvic floor therapy, using the dilator to release muscle
Yeah.
tension. Um, addressing maybe like past experiences of trauma with maybe a therapist or someone who is trained to help people work through those things. And then also, I think one of the most important things is to recognize that painful sex is not just normal, right?
Mm-mm.
Like if we think that, oh, well, it's normal to have painful sex, then we don't do anything about it and we just live with it. And then over time, it can cause a lot of negative consequences, not only for our relationship with ourselves, our relationship with our body, but also our relationships with our partners and our intimacy. So, as you mentioned before, like we deserve to have pleasurable sex.
Yeah,
Yeah.
absolutely. Yes. And I've had patients too who've come in and they say, well, this is kind of my last resort because if I can't have sex, then I'm going to get a divorce because my spouse can't handle it anymore. And to me, that's really sad too, that they've gone through this for so long and no one ever said, let's try pelvic floor therapy, or let's try working with Celeste. Let's try, doing all these things. Because why not? If we can find the root cause of what's going on and let them have fun in life again and feel like they can do whatever they want to do, let's do that. They deserve to have that.
Absolutely. I love your passion for helping women experience pleasure and joy in their lives. And so I'm curious if women are watching this video and they're like, or listening to the podcast and they're like, that's me. I want to discover more. I want to learn more. I want to work with Sara and address the root cause of painful sex. How do they find you? What would be that route for them?
Yeah, so cultivatephysicaltherapy.com is my website. So you can kind of go on there and learn a little bit more about me. And then a good way to get in contact with me is either the contact form on my website or email works too. I'll always get back to you with that as well. So
absolutely. Well, thank you so much for allowing us to talk about this topic here on our Women's Empowerment series. And I look forward to seeing all of the amazing things that you do for women in the Central Iowa area. And yeah, thank you so much.
Yes, thank you, Celeste.
This has been a production of the Sensual Leadership Academy. Thank you for joining us on this empowering journey of self-discovery and growth. Remember, you hold the power to create a life filled with passion, love, and fulfillment. Keep embracing your sensuality, nurturing your relationships, and living life on your own terms. This is Frequency of Pleasure, empowering women in sex, love, and life. Learn more at www.sensualleadershipacademy.com.